The Bahrain Oncology Center at King Hamad Hospital has acquired the commissioned MR LINAC unit, which is another step towards providing advanced radiation therapy that is unprecedented in the entire GCC region. This acquisition of technology in cancer care comes out of commitment and dedication to provide state-of-the-art and comprehensive cancer care. To speak more about this, we are joined by the director of Bahrain Oncology Center, Professor Elias Fadel. Hello, Professor Elias. Tell us about the new and revolutionary addition of equipment and services at Bahrain Oncology Center, and how can they further improve the kingdom's healthcare sector and deal with such costly treatments?
Yes, and good evening. As already known, the Bahrain Oncology Center, supported by the King Hamad University Hospital, is the Bahrain National Cancer Institute, with the mission of providing Bahraini nationals and citizens with a world standard comprehensive care in the domain of hematology and oncology. And allow me, please, before talking about the new machines and technology, to mention that many Bahraini care workers are sponsored to undergo advanced studies and training in internationally reputed institutions, while others are already enrolled in the valuable workforce of our center. And concerning the machine and willing to keep up with the latest advances in medicine, the center launched on the 27th of June the MR LINAC services as part of its state-of-the-art armamentarium in the field of radiation oncology. In fact, this machine, the MR LINAC, allows what we call a personalized radiation therapy, meaning by this that each tumor will have a specially designed treatment. This is possible because this machine contains in the same time an MRI device, which is an imaging device allowing diagnostic capabilities, and a linear accelerator. And the originality of this machine is that the MRI keeps viewing the tumor while the treatment is given. So it's a kind of dynamic way of giving a treatment. The tumor will be all the time visualized during the shooting of the tumor by the radiations. The advantage of this technique, of this technology, is when the tumor moves from its position, and we're talking about millimeters, for example, during the respiration, the machine is able by itself to follow the tumor, and if the tumor moves more than a certain number of millimeters, the machine stops shooting with the radiation therapy and resume the treatment when the tumor goes back to its target position. What does it mean? It means that you are able at every second of the treatment to give the highest concentrated radiation therapy to the tumor, and in the same time you are avoiding the irradiation of the safe tissues surrounding the tumor. So in this way, you have an improved or highest therapeutic efficacy, and you have a major decrease in the side effects. So just to mention that this machine is the 7th of its kind delivered by the manufacturing company, Electa, at worldwide level, and it's first machine from Electa in the Middle East and the whole continent of Africa. And added to this machine, I would like to mention, if you allow me, the growing number of patients in our center. Added to the growing cost of the anti-cancer agents, which is translating in huge constraints on our budget. Just to give you an idea, from a pre-planned 467 new cancer cases diagnosed in Bahrain at the opening of the center, as by the national statistics at that time, the numbers of patients are growing to reach 1,300 in 2020, and we are expecting this number to increase even more in 2021. And this definitely reflects, in part of it, the confidence of the Bahrain community in the services of the center.
Director of Bahrain Oncology Center, Professor Elias Fadel, thank you for joining us.